It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high, that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program.
Health insurance, simply put, is just an insurance that you take out that will pay for the cost of health or medical care.
Kidneys are the organs that filter waste products from the blood. The kidneys play key roles in body function, not only by filtering the blood and getting rid of waste products, but also by balancing the electrolyte levels in the blood, controlling blood pressure, and stimulating the production of red blood cells. The kidneys are located in the abdomen, towards the back, normally one on each side of the spine. Symptoms of kidney failures are due to blood build-up of waste products and excess fluid in the body that may cause weakness, shortness of breath, lethargy, swelling, and confusion. Inability to remove potassium from the bloodstream may lead to abnormal heart rhythm and sudden death. Today on your favorite health TV talk show, The Physicians, we'll be talking about kidney failure, the risk factors, symptoms, diagnosis, management, and of course, the prevention. Welcome. This is your favorite health TV talk show, The Physicians, where your health is our business. Today on the show, we'll be talking about kidney failure, the symptoms, presentation, risk factors, management, and of course, the prevention. My name is Dr. Memuna Yusuf Kadri, and of course, with my regular health TV talk show.
My name is Dr. Martina Agberia. Welcome to the physicians where your health will always be our business.
You look good.
Thank you. You too. You look radiant. Pink.
I'm looking pinky.
Oh, for sure.
Whatever. I don't even know what the colors are.
You look really good.
Yeah,
Good on you.
and thank you very
Do
much.
more of this, right?
Really?
Yeah.
Okay.
Good.
I'll take note of that. We're talking about kidney failure, and it has something to do with urine too.
Yes.
The color of urine and all that.
Yes.
But you know, the reason why I love this particular topic is we cannot talk about it enough. It's the rise,
the increase in the number of people having
with
dialysis, kidney
it's
failure. a whole lot.
amazing. Young children are now involved. So it's not just about as you get older, the organs are getting
or
older.
you're using the bleaching cream.
That is the one that is not, I'm not aligning. I can't understand why mothers will use bleaching cream and also use for their children.
They don't even know that it contains that particular chemical.
And now we're having kids come down with kidney failures.
It's sad and disheartening. It's not cheap to even manage.
That is it, because dialysis, now everybody, they will not come online and raise funds for so. Yes, but there are people that genuinely need that funding, but there are some people that you just be wondering, how did it
In all this is actually what can be prevented.
That is where we, and I'm happy we have an expert coming on who is an expert, an encyclopedia, and with a knowledge full, and people really
That
need
is
to.
her field. She's a
The nephrologist. And you know, the good thing about kidney is that God has dashed us two. We actually need one.
Yes, we need one, but there's a reason why we have the two.
So it's good we have an expert who is going to school us. You know, tell to people out there that, look, these kidneys you have, guide them jealously. So we'll be right back after this short break. Stay tuned. back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today we'll be narrowing down and zoning into a very important health topic that is becoming almost like an epidemic. Yeah, a menace, yeah. And we really need to be schooled about it. For those of us that know about it, you'll be reminded. For those that don't even know anything about it, this is the time for you to get your paper, pen, get your neighbors. In fact, in Nigeria, we say, Ara Adugo, bring them on board because we are going to be totally schooled on kidney failure, the symptoms, presentation, risk factors, management, and of course, the prevention. And with us in the studio today is no other person than the amazing, beautiful damsel consultant nephrologist and physician, Dr. Olamide Olowoyo. I like the way that's the surname is. Yeah, she's the head of Department of Nephrology, Federal Medical Center, EBUTE-META, Lagos, Nigeria. Doc, you are welcome.
Thank you for having me.
You look amazing.
You look amazing. I'm very calm.
You know, we don't want to pray for bad things, right? But you know, these are doctors you want to see, and you fall ill, then so that the doctor will see you, and then the illness will get better.
Yeah, right. Thank you.
Congratulations, at least you're still around. You're still in Nigeria. Please don't go.
I'm very much around.
Thank you. We need you. We need you here.
Thank
More
you.
of nephrologists now
We
than
don't have
ever.
enough nephrologists.
Now than ever.
No, we don't.
So, Dr. Olowoyo, now we're talking about kidney failure. Okay. Let's have a general overview of, in fact, why the kidney? What's the importance? And how did we even get to where we are right now?
Okay, so kidney failure is actually a very broad term. There are two major things under it. So we have the acute kidney injury. In the past, it used to be called acute kidney failure, many other terminologies, but now it's called acute kidney injury. And then we have the chronic kidney disease. And what differentiates them basically is the time frame. So the acute happens suddenly. Any insult to the kidney that occurs suddenly within hours to days, it's acute. And then chronic kidney disease is over 3 months. So whatever injury persists for more than 3 months, it's chronic kidney disease. So, and then there are different causes of both of them. But because of time constraint, I think we'll focus more on the chronic kidney disease today.
But where are the kidneys located?
Yeah.
So that they can have an idea.
Okay, so the kidneys are located, I'll point at the back.
Okay. The lower back.
That's where we call the flank. So that's the location of the kidneys.
Why two? Why not just one?
Okay, so, well, two, they both contribute to urine production and excretion of waste products, basically. So the two are very important. However, some people are born with just one. Congenitally, they are just born that way. And, you know, some people never even know that they have just one, unless they do a scan. Some do it in their 50s, some in their 60s, and then they find out, oh, really, I never knew. So with one kidney, some people can still live normal lives. But usually we have two. Just like most other organs in the body too. They are paired for dual action.
So what are the causes of kidney failure?
Okay, so the causes of, like I said, I'll focus more on the chronic kidney disease.
Yeah.
There are quite many. But in this environment, the common ones we see, most notorious is hypertension. Then we have what we call chronic glomerulonephritis, which is like an inflammation of the kidney that has persisted for a long time. Then others are diabetes. So those three are like the top
Big
three,
diseases,
big things. And then we now have other things like hereditary kidney diseases, like polycystic kidneys, in which the kidneys just have a lot of cysts in them. They're really large, and they can cause kidney failure over time, or kidney disease over time. And then we have things like HIV, things like hepatitis, sickle cell disease, and so many others. And then now we're having people that take a lot of medications, pain analgesics, so they can actually come down with kidney disease. And then we have people that take herbal concussion, so a lot of toxins can actually damage the kidneys.
So I'm not cutting you, so that our viewers can understand it more. Maybe we talk about the functions of the kidney. What does the kidney do?
Okay. So the kidney, majorly, like I said, it excretes a lot of waste products. So it receives about a quarter of the total blood volume per every minute. So 25% of what is coming from the heart goes to the kidney. Yes. So through that, it's able to excrete a lot of waste. So there are different wastes: urea, creatinine, potassium. A lot of them, they're excreted in our urine, which is what we see. And then apart from removing waste too, it helps with some production of blood cells. There's a hormone called erythropoietin that the kidneys produce. So it helps with production of blood. It helps with, like I said, excretion of so many other things, uric acid. So when the kidneys are not working well, those products build up in the body, and they can build up to very dangerous levels.
So what are the first warning signs of kidney failure?
So kidney disease, like I said, that's chronic kidney disease now. The early warning signs for most people is weakness. A lot of people just feel tired. They just can't explain what is going on. So weakness. Some people tend to urinate so often. So like during the day, going to the toilet 15 times. At night, waking up to 5-10 times, it could be a problem. So, and it's because the kidneys are not concentrating urine. So one of the things the kidney does is also to concentrate urine. So if it's not able to concentrate urine, the person is just passing it out. As you are drinking water, it's coming out. So the kidneys are not concentrating urine at all. So those are some of the early signs. And then as it progresses, they tend to have facial puffiness, tend to have leg swelling, and then it keeps getting worse and worse. Is when it gets to advanced stages that people start to have vomiting, because when the urea and other waste products build up, people start to vomit. They may have altered sleep patterns. So instead of sleeping in the morning, they sleep more, sleeping at night, they sleep more in the morning, and then there's a reversal of sleep pattern. Some people have persistent hiccups. It's not, of course, everybody has hiccups, so when it becomes persistent, it could be a sign. And then some people start having seizures, loss of consciousness. So those are advanced chronic kidney disease features.
So at this point, right, and we don't want to go away without nipping it on board. We are beginning to have an increase in the rate of people coming down with kidney failure. And one of the things your department, your specialty is, really talking about now is people should stop bleaching. What is the link?
Okay, so a lot of the bleaching agents, they contain all sorts. So mercury containing soaps and creams and so many other products. So a lot of people just use them. And it's not one-time use. A lot of people use it over years, over months, and eventually it affects the kidney in some cases. Okay.
Why on babies too?
I really don't. I can't put my mind to it. I don't know why. People just want their baby to be what we call yellow.
Mulatto.
Mulatto.
It's so annoying.
It doesn't make any sense.
Doesn't make sense.
If the adults doesn't even care about their own health, at least pity the small children.
The child has a right.
Exactly. So I don't know why we are bleaching. And black is beautiful.
Yeah. Beautiful, no. Melanin pumping, it never cracks.
Honestly.
But in your current practice, being the head of the department, which age group are you seeing more now? Is it more of the younger or the older? Is there any gender preference? Yes.
Okay, so well, in this environment, we tend to have people in the younger age group compared to the developed world.
Younger age group in Nigeria?
Yes, and those are the economically productive people. So people in their 30s, 40s, 50s. Well, it's probably a genetic thing too. Then over there, they have more of elderly people because of cancers and some other things. But here, hypertension, people are not checking their blood pressure. Even those that have it, they're not taking their medications. People are diabetic, they don't take their medications regularly. So poor follow-up. So people here tend to come with advanced disease. By the time we are picking somebody, it's already in stage 5 a lot of times. Yes. So those are some of the things contributing to our own presentation. And then blacks too tend to have more severe hypertension. Even their hypertension tends to be more difficult to control. So those are some of the things contributing to our own peculiar demographics. There was a case some years ago that children, if you remember, one teething medicine that a lot of children took and had kidney disease, had to do dialysis. It was quite a problem. So yes, medications could be
In fact, I love the fact that we're talking about fake drugs and how it's contributing to kidney failure in our society. And for the fact that in Nigeria, it's our younger, productive age group people that are coming down with
It's not a good sign.
It's not a good sign.
it's not.
It's
not a good sign.
Do you know what? In fact, I don't even want to even go, because if our future leaders are coming down with
this now,
then what becomes of the economy and the human capital index and all the GDPs and all the big things economists are telling
in a
us?
society that's already ill.
It's a major problem.
Society that's already ill. I will take that away from it. Let's keep up with the physicians on the street line. Let's hear from you what you think about kidney failure. Have anybody who has had kidney failure, and just your view on what kidney failure is. We'll be right back after this time out. Stay tuned.
Yes.
Yes, I have.
Yes?
Yes, exactly.
Somewhere, it's inside the body. I'm not sure, but maybe like in the middle, somewhere, yes.
They are right below your spine.
It's here, it's at my rib.
Yes, it's located at the waist region, around this corner side. That is the kidney.
They help to filter your blood, excess water in the body, generally wastes.
I guess they help with like the toxins in our body. I'm not really sure.
Yes, the functions of a kidney is it makes the lifespan of a man to be growing, to last longer.
One of the functions of the kidney is to help for easy urination, to pass in urine out of the body system.
Welcome back. If you're just joining us, we'll be talking about kidney failure, the symptoms, presentation, risk factors, management, prevention. And with us in the studio, she has been doing an amazing job, schooling us on what kidney failure is all about. Dr. Olowoyo, you have been doing such a beautiful job, just telling us what the different type of failures and what could be the risk factors and all that. Now let's dive into management. Okay. How do we manage kidney failure?
Okay, so like I said, there's acute and there's chronic. So if it's the acute one, that one is usually due to some sudden insults to the kidney. It could be infections, it could be medications, a lot of them too are causes of the chronic kidney disease.
Like dehydration for acute?
Yes, dehydration, blood loss. So if someone loses a lot of blood, loses a lot of fluid, diarrhea, postpartum, someone that just delivers loses a lot of blood, so they can come with acute.
I like the acute one. When I say I like the acute one, those are the things. Yes, those are the things that just can happen. Basic things, dehydration. People that are not
dehydration. Let's even nip it on board. Let the essence of drinking water as against colored drinks. Yes, because there are two different things.
Yes,
you're
right.
Good.
So the acute ones, usually when you take care of whatever is causing it, so if it's dehydration, you rehydrate as much as possible. If someone has diarrhea, just give a lot of fluids, the person recovers. Blood loss, you transfuse. So those ones are a bit easier to manage. But the chronic, it depends on the stage. So it's in stages 1 to 5. 1 being the mildest, 5 being the most advanced or severe. So stage 1, 2, 3, we manage conservatively. Even stage 4, you usually manage conservatively. That's you just tackle the problems as they come. And then it's usually when people get to stage 5 that they become symptomatic. Late stage 5, that's when they have those symptoms I spoke about, vomiting, persistent hiccups, seizures. So that's advanced stage 5. So the conservative management, you take care if they have, like I said, the kidneys produce blood, so the blood may be on the low side. So you take care of if they have shortage of blood, you take care of their calcium balance in the body, and you take care of uric acid, you advise them on diet. So those are things we do. That's conservative management. If they have high potassium too, there are some medications you can give. So you treat their blood pressure, their blood glucose, make sure it's controlled. So that's for the conservative. However, people that now become more symptomatic, they may require what we call renal replacement therapy, which could be in forms of dialysis. Dialysis could be peritoneal dialysis or hemodialysis. The one we have commonly in Nigeria is the hemodialysis. And then transplantation, kidney transplantation, that's another form of renal replacement therapy. So advanced kidney disease, people need to have either dialysis or kidney transplant.
What does the peritoneal dialysis entail?
Okay, so that entails...
because I know they do that at home. Patients can do that at home.
Yes, they can do it at home. Nigeria too, we're having a few centers that are doing it. We have a company that just started marketing the fluids. So what it is, people in the comfort of their homes, they can do their exchanges. So they put some fluid in the abdomen. It dwells there, stays in the abdomen for a few hours, and then some of the waste products get into the fluid, and then after a few hours, you exchange, you discard the bad one, put a fresh one, so they can exchange every 4 hours. And then there are even automated ones that at home, while one is sleeping, the exchange can continue. So that's a bit easier. It's just that for now, for some reason, the fluids are not really in circulation in the country. So we have more of hemodialysis, that people have to go to dialysis centers, stay there for usually 4 hours.
What's the average cost for dialysis? And how often?
So it depends on
in
the
a range.
center.
Yeah, maybe a range.
The range?
A range will be about between 50 and 70,000.
How many times a week, depending on?
So depending on how bad it is, the recommendation is actually 3 times a week.
So 150,000 a week.
See the way you are calculating it.
That's just for dialysis.
Yes.
Mind you, we have medications.
I'm saying this, a minimum of 150,000. I'm saying this so that
110,000.
Absolutely. So that's a 200,000 a week.
At least.
At least to have dialysis done for
a month, 800,000.
I don't even want to go to a month, 800,000. Okay. I'm saying this because we are aware.
Yeah.
It is easier to prevention is always better than cure.
And one thing I should also say, Nigeria, we pay out of pocket.
You are right.
Places that have insurance, so people can just not, it's not affordable. It's not affordable. It's just not affordable. The ordinary man is just not affordable.
Doctor, before we leave, I want you to talk to our audience. You know, those tips things they should do, because we are talking about prevention right now. What we should focus on, so that people won't have to be spending this 200,000 naira per.
Is it possible for somebody to recover?
Yeah.
Okay.
And for one who does that, is it for life?
Yeah.
Okay.
Possible complications if you do not take care of yourself?
Okay, so let me start with
the prevention.
So, like I said, Nigerians or Africans in particular, we present late. So one of the things one can do is to even go for regular medical checkups. So maybe every 3 months, just check your blood pressure. That's the minimum one can do. So check blood pressure, check your blood glucose once in a while. You know, it could be every 6 months. Just make it a habit of checking.
Yearly medicals.
Yearly medicals. Check your urine. If there's protein, it will be detected early enough. And then a lot of other things. Some people have genetic problems too. So if you do an abdominal scan, it may pick if there's any problem with the kidneys sometimes. Okay, so those are the things that one can do. And then if one has hypertension or diabetes, make sure you're seeing a trained physician to make sure those things are controlled. The blood pressure, the blood glucose is controlled. So all those things are things that can help to prevent kidney disease. And then also avoiding indiscriminate use of medications, like we said, especially pain medications. Making sure we source for drugs from approved pharmacies. Yes, you don't just go to the market and bend down by the roadside and start picking medications.
All those agbo.
Agbo, herbal concussions. So significantly, people don't know what's in them, so they just keep giving us by the roadside too, you know. So those are some of the things that contribute. So avoiding them too is a major thing that we tell people. Bleaching creams, you can avoid. And then, so those are the main things.
So thank you so much. We're hoping next time we call you, you oblige us and come on board. To our viewers out there, you see, when we say drink water on this show, we mean it too. We are not saying colored water. Anything that has taste, that has color, that has smell is not water. So please, as a viewer, don't forget to keep up with us at any point in time. My name is Dr. Memuna Yusuf Kadiri.
Thank you so much, Dr. Olowoyo. It's really nice having you. It's a privilege as physicians to have you here on our program.
Thank you very much.
Very few nephrologists that we have, and we actually brought it Oh, I'm sure I've just it's not easy to have nephrologists around. So we are really very, very grateful. And so everybody out there who actually keyed in, we just want to say thank you for always keeping a date with the physicians, because your health is always our business. Remember to follow us on our social media handles, on our YouTube, on our Facebook, on Instagram. And if you want to be part of this program, go to our website, which is up and running. Just complete the form, and you'll be invited. On a final note, remember to rehydrate regularly. Yeah. Take water as often as possible. When I say water, I mean water, not colored water. Thank you so much. I am Dr. Martina Agbere. Stay blessed.